Hey guys, Dr. Davin Lim, board certified dermatologist. Today we'll be talking about the differences between at-home microneedling kits compared to what specialists use, as in what we use in office. At-home kits now are readily available through the internet. Everything from derma rollers, as in skin rollers, all the way to things like pens, derma pen, skin pen, doctor pen. These are all readily available. And with the influx of how cheap things are with Chinese products, look, let's face it, most of these, including really high-end, well-known brands, they make this stuff in China. So whether you buy it off eBay, Amazon's, or you go to your doctor's office, the pens that we use, as in the non-RF or the non-energy delivered pens, the microneedling, the rollers and all, most of these are made in China. Very exceptional to have I guess these products made in places like the US or Japan or Korea because of the sheer cost of things. So what's the difference between what you buy on eBay or Amazon compared to what we use? Sometimes there is no difference, truthfully, because we use microneedle. So in my practice, I use everything from straightforward microneedling, which is something like a doctor pen, the skin pen or derma pen, all the way to higher energy devices. But I also use skin rollers, the old-fashioned derma rollers, not because I think they're better than the other devices that we use. I use derma rollers and skin pens when I want to get the product into the dermis. So in other words, for things like hypertrophic scars, keloid scars, anything which I need to deliver into the dermal layer, that's when I use a pen. The reason being is that with a laser, you often get the char, you often get the bleeding, well, mainly char, especially with the CO2 laser, that I don't have good product penetration. The other thing is, I don't want collateral damage sometimes, and for that, I just want little core holes, and just using a simple pen, and you know what I do? Sometimes I actually use a needle, so you can see me sometimes when I'm revising scars. I'll use a needle, put it at the end of the needle holder, and manually needle, because that way I can control where I want the product, how deep. I get the tactile feel of what the needle's doing. So it tells me a lot of things just by using it manually. So everything from manual devices all the way to RF devices. So what you use at home, generally speaking, look, if it's a derma roller or skin roller, most dermatologists would advise 0.25 maximum, Anything more than that, I'm sure you've seen a lot of the ads where they say, compared to a pen delivered system, you can cause tears in your dermis from your skin rollers. The answer is yes, it can. We can demonstrate that using the rollers and let's say jelly, and then have a look at the actual pattern. Yes, if you do it incorrectly, it can. But anything less than 0.3 mil, I think it's safe at home. Obviously, you don't do that around your eyes, but on your cheeks, on your upper lips, certainly that can help. So it's important to get traction of your skin. I've done a couple of videos in regards to this, If not, head over to my Instagram link and it explains microneedling and in some cases how to actually do it safely. And like I said, these home devices, if you do use it sensibly, I think is a good option for the treatment of certain conditions. So if you got a hammer, everything looks like a nail. So if you've got one system or one, device, you can't treat everything with it. I mean, certainly devices like these are good for things like, at-home stimulation of collagen, so CIT, collagen induction therapy. They're great for very mild, non-tethered atrophic scars, and for mild cases of wrinkling. By all means, have nothing against them. And like I said, we use them day in, day out in our practice. So with at-home devices, the power usually, even when you're using an electrical system, we've tested a lot, a lot of systems, all the way from $50 systems all the way up to $3,000-$4,000 systems. Generally speaking, if you're using a system whereby the batteries are fully charged and you're using conservative depths, by all means, it's very hard to tell the difference, even with feel nowadays. We're not talking about devices that are made 2-3 years ago. Nowadays, because the motor on these devices are pretty strong. So even from relatively cheap Amazon purchases, and once again, it's 0.25. I'm not talking about going down to 2 to 3 mils. We're talking about conservative, sensible treatment. It is very hard to tell the difference from a tactile feel with these devices nowadays, right? So 12 months ago, 24 months ago, definitely. We've tested those systems out, and you can see or you can feel that the ones that are cheaply made, their motor isn't strong. But now, like I said, technology's caught up, much like buying a lot of electronics or lots of gear from China. A lot of the stuff now, it's very similar, yeah. But obviously, when you're using deeper depth, so when you're talking about greater than 1 mil, when we have to go in 2.5, 3 mils, that's something which I've not tested, because I think it's probably need to go to ethics approval for that, because I think the medically, I guess, graded devices or the branded things like Dermapen and all, they probably have that edge because of more robust studies. But if you're using something sensible at home, by all means, even a roller. And patients will go, well, I need to bleed. If you do it correctly, seriously, at 0.15, 0.2 mils, I can make anyone bleed at 0.25 mils. Yeah, all you need to do is put a little bit of pressure, traction, counter traction, and then rolling. So you've got to be sensible with that. Anything more than that, like I said, is probably not great. So how does that differ compared to the microneedling devices that I use or dermatologists use? Well, let's have a look at different things, yeah? Because with our devices or the devices that we use where there's energy involved, we are using controlled energy, usually in the form of radio frequency or RF, because that's what we call RFM or radio frequency microneedling. When we use these devices, we generate heat with control heat. So with a control heat, we're generating through the pathway of something called heat shock protein. So HSP70, HSP90, these heat shock protein can actually stimulate more collagen. So that's control heat. That's why lasers and radio frequency microneedling, as compared with the non-energy devices, they certainly do stack up a little bit better in most cases compared to just Dermapen, for example. But once again, you got to use it in context, because if I'm trying to get into the dermal layer, for example, to deliver corticosteroids for something like hypertrophic scarring or tethered scarring, where there's a lot of fibrosis, I do not want to use a laser because you've got char and I can't get the steroid in, especially if I'm dripping or occluding it. So that's when I use the non-energy devices. Or when you see me using an energy device, I'll use an energy device, for example, for treating, scars or laxity, and then I'll switch off the energy and I'll use the action of the actual mechanism to get into the dermis, but without heat. Yeah. So these devices are very flexible. We can use it with heat, with energy, and we can control the energy. So we can control everything from the power to the pulse duration to increase the total amount of energy or millijoules per pin. So we can start off conservatively and we can go high as needed. Look, generally speaking, if someone goes, look, that device hurts a lot, and for all RFM devices, they should all cause some kind of discomfort, yeah? It's not that it's uncomfortable. It is uncomfortable, but pain itself can be controlled using either topicals, injections, sedatives, gas, for example, nitrous oxide. There are many ways to control the pain. What we don't like to see, most of us don't like to see, is that if we advise a treatment where there's heat involved, especially with RFM, radio frequency microneedling, but then the procedure itself is very well tolerated with very, very little pain and no anesthesia used, chances are that event was made very little impact on your actual skin. So we understand now, in order to actually cause denaturation of collagen remodeling, generally speaking, we need to go somewhere about 64 to 68 degrees. And generally speaking, that hurts, yeah? So as dermatologists, plastic surgeons, in our specialty, we can anticipate the actual procedure itself and go, wow, that's gonna hurt, and then come up with ways to decrease it. Like I said, whether it be local anesthetic, either blocks, either injections, really good numbing cream, and in some cases sedation. So generally speaking, look, this is just generally speaking, if a procedure where you're using energy does not hurt at least a little bit, chances are it's not working, yeah, because we're not generating that kind of heat. So in the context of RFM, there are different types. There's insulated versus non-insulated. So the non-insulated ones, I call them generation 1, generation 2 devices. So things like, for example, intensive, secret. These are all radio frequency devices that do not have insulation. The newer ones, or well, even the older generation ones, for example, like Intracell, yeah, they contain insulation. And the newer ones, for example, like Infini and Genius RF, they contain insulation as well. So insulation is a pretty important thing because if we want to decrease the amount of collateral damage to your skin, we want to have the energy where the concentrated at the tip. So the tip, for example, may be at 3 mils and we want energy concentrated there. We can dial it in with our device. And if they got a good pneumatic system, or if they got a good delivery system with the needles, we can almost count that it's actually delivering it at that depth. And there's some devices, especially with the early generation, where we dial in a depth, for example, 2.5 mils, and we're lucky to go down 1.5 mils. So devices do count, and I do think that Lutronic makes some really good devices. In the context of RFM, probably if I'm going to rank pretty good devices, it will be Genius, definitely one of them, RFM from Lutronic. Another one is Morpheus 8, yeah, made by InMode. I've never used that device. I probably will try it out in the next couple of weeks just to see. That way I can speak, I guess, with a little bit more expertise on all the different systems rather than me using one system and go, well, this is the best system because I use it. No, I think it's good to try other systems. And I'll give you some feedback in regards to things. I'll show you some videos down the track in regards to how these different systems work. Why, for example, impedance control with the Lutronic system and the biofeedback. In other words, every time you pulse, you make them, for example, if it's a bad pulse, the RF device tells you it's a bad pulse, so we know to correct, I guess, user error. All of these make a lot of difference. And also the quality of insulation, because we know that insulation itself, when we're looking at the needles, if you go too high up with the energy, you cause charring, and hence you'll lose insulation. So with the previous generation models, for example, Genius, yeah, I used to use a lot of that. I used to get lots of char because when I turn up the millijoules, turn up the energy, I get charring of the tissue, which is also transferred to the needles. So I have black tips at the end, which means the insulation is gone. And hence, it's very important to have devices which you can count on, devices which give you good feedback, devices will give you adequate amount of energy, and an accurate way of delivering it. So guys, I hope you liked that video. It's it's what, 14 minutes? It's, I guess, an explanation of, I guess, the whole realm of microneedling and how dermatologists approach things, including our devices that we use. So guys, stay safe. Remember, if you're going to microneedle at home, if you're going to actually roll at home, stick to 0.25 a maximum, right? That's the correct way of doing things. That way you won't get, or you should not, or actually decrease your chance of any scarring at home or any, I guess, yeah, adverse reactions. So guys, hope you like that video. More on my Instagram channel, and I'll see you next week. Bye for now.